Have you ever woken up and felt like you were walking on bubble wrap? Or maybe you're sitting down right now and there's a persistent, annoying tingling, a burning sensation, or complete numbness creeping from your toes up into your calves. If you're dealing with these symptoms, I want you to know two things right away. First, you are absolutely not alone. Second, ignoring it is the worst thing you can do. Millions of people suffer from a condition known as peripheral neuropathy or nerve irritation. It can rob you of your balance, disrupt your sleep, and make simple tasks like walking to the mailbox feel like a monumental challenge. Hi, I'm Dr. Franklin Reed, and welcome to what I call the ultimate masterclass on foot and leg numbness. Today, we are not just going to put a Band-Aid on your symptoms, we are going deep. In this comprehensive video, we are going to explore exactly why your nerves are misfiring based on the latest medical science. We'll discuss what the current clinical guidelines say about medications, what works and what doesn't. But most importantly, I'm going to walk you through a complete, evidence-based physical rehabilitation routine. I'll show you the exact exercises, stretches, and home therapies that you can start doing today to improve blood flow, stimulate nerve healing, and get your life back. This is going to be a detailed journey, so grab a glass of water, find a comfortable chair, maybe take some notes, and let's dive into healing your nerves. To fix a problem, we first have to understand the machine. Your body is wired with an intricate electrical system. Think of your brain and spinal cord as the main power plant. From that power plant, thousands of wires, your peripheral nerves, travel all the way down to the very tips of your toes. These nerves have two main jobs. Motor nerves tell your muscles to move. Sensory nerves send information back to the brain, things like temperature, pain, and vibration. Now, nerves are incredibly delicate. They are protected by a coating called the myelin sheath, much like the rubber insulation around a copper electrical wire. When you experience numbness, tingling, or that pins and needles sensation, which doctors call paresthesia, it means that the insulation around the wire is damaged, or the wire itself is struggling to get enough oxygen and nutrients. The signals are short-circuiting. The brain gets confused by these broken signals, and it interprets them as burning, stinging, or numbness. But why does this happen? The latest medical guidelines categorize the causes of this nerve damage into a few major buckets. Let's break them down so you can figure out which one might be affecting you. Number 1, metabolic causes, specifically diabetes. This is the heavy hitter. According to the American Diabetes Association, up to half of all people with diabetes will eventually develop diabetic peripheral neuropathy. Here is how it works. Chronically high blood sugar is essentially toxic to your blood vessels. It damages the tiny capillaries that feed your nerves. If the nerves don't get blood, they starve. If they starve, they die. This usually starts in the longest nerves first, which is why you feel it in your toes and feet before you feel it anywhere else. We call this a stocking glove pattern. Number 2, nutritional deficiencies. You cannot build healthy nerve insulation without the right building blocks. The most critical of these is vitamin B12. If you are deficient in B12, which is common in older adults, vegetarians, vegans, and people taking certain heartburn medications, your body simply cannot maintain the myelin sheath. We also look at vitamin D3. Recent clinical studies show a strong correlation between low vitamin D levels and increased neuropathic pain. Number 3, mechanical compression. Sometimes the nerve isn't diseased, it's just trapped. If you have a herniated disc in your lower back, it can pinch the sciatic nerve. This sends a shooting, tingling pain down the back of your leg and into your foot. This is called sciatica or radiculopathy. Alternatively, you might have a pinched nerve in your ankle known as tarsal tunnel syndrome. Number 4, toxic or autoimmune factors. This includes damage from chemotherapy drugs, heavy alcohol use, or autoimmune conditions where your body's own immune system mistakenly attacks your nerves. Identifying your specific cause is step 1. You must work with your healthcare provider to get the right blood tests. You cannot out-exercise a severe B12 deficiency, and you cannot stretch away uncontrolled blood sugar. Treat the root cause first. Let's talk about medical management. If you go to a neurologist today, what does the latest clinical science say they should do for you? In the past, doctors sometimes prescribed strong painkillers, including opioids, for nerve pain. I want to be very clear. The latest clinical guidelines strongly recommend against using opioids for chronic peripheral neuropathy. They simply do not work well for nerve pain long term, and the risks of addiction and side effects are far too high. Instead, modern medicine approaches nerve pain differently. Because the nerves are misfiring, we use medications that calm the nervous system down. The first-line treatments usually fall into three categories. First, gabapentinoids, medications like gabapentin or pregabalin. Originally developed for seizures, we found they are excellent at quieting down overactive burning nerves. Second, SNRIs, or serotonin and norepinephrine reuptake inhibitors, drugs like duloxetine. While classified as antidepressants, they change the way your brain processes pain signals from your body. Third, topical treatments. If the pain is localized to just your feet, guidelines highly recommend trying topical treatments first. This includes capsaicin patches, derived from chili peppers, which deplete pain chemicals in the local nerves, or lidocaine patches to numb the area without causing systemic side effects. Medication is a tool to manage the pain so you can improve your quality of life. But medication does not heal the nerve. To encourage nerve healing and prevent further decay, we have to look at lifestyle, nutrition, and physical movement. Let's talk about the fuel you are putting into your body. Nerves take a long time to heal. We are talking millimeters per month. To give them the best chance, you need an anti-inflammatory environment. Number one is blood sugar control. If your numbness is caused by diabetes or prediabetes, controlling your blood glucose is non-negotiable. Spikes in blood sugar act like shards of glass in your tiny blood vessels. Focus on whole foods, lean proteins, high fiber, and drastically cut down on refined sugars and simple carbohydrates. Number two, the B vitamins. As I mentioned, vitamin B12 is crucial for nerve repair. But the whole B complex is important, particularly B1 and B6. You can get these from lean meats, fish, eggs, and fortified nutritional yeast. If your blood tests show you are low, your doctor might recommend a high-quality B complex supplement. Just be careful with B6 supplements. Taking too much synthetic B6 can actually cause neuropathy, so stick to the recommended doses. Number three, vitamin D3. If you live in the Northern Hemisphere, work indoors, or are over the age of 50, there is a high chance you are deficient in vitamin D3. The latest research indicates that optimal D3 levels, usually between 50 to 80 nanograms per milliliter, are vital for nerve health and pain modulation. Get your levels checked. Number four, alpha-lipoic acid, or ALA. This is a powerful antioxidant. Clinical trials have shown that taking 600 milligrams of alpha-lipoic acid daily can significantly reduce the symptoms of diabetic peripheral neuropathy, specifically the burning and pain. It helps reduce oxidative stress on the nerves. Discuss this with your doctor, as it is one of the few supplements with robust clinical backing for nerve pain. Now we reach the most actionable part of this masterclass, movement. Why do we exercise for nerve pain? Two reasons. First, movement increases local blood flow. Blood carries oxygen and nutrients to starving nerves. Second, movement stimulates neuroplasticity. We are forcing the brain to pay attention to the feet, waking up dormant nerve pathways. This routine is broken down into three phases: sensory awakening, mobility and blood flow, and nerve gliding. Important safety note: if you have severe diabetic neuropathy and have lost protective sensation, meaning you cannot feel if you step on a sharp object, you must be very careful. Always inspect your feet daily for cuts or sores, and do these exercises in a safe, controlled environment. If any movement causes sharp shooting pain that is different from your usual tingling, stop immediately. Let's begin. We are going to start with phase one, waking up the bottom of the foot. The plantar fascia is a thick band of tissue on the sole of your foot. It is rich in nerve endings. By massaging it, we stimulate blood flow and send strong sensory signals up to the brain. For exercise one, the plantar roll. Take a massage ball, like a lacrosse ball or a tennis ball. Place it under the arch of your right foot. Now, apply a mild to moderate amount of pressure. Do not push so hard that you wince in pain. Slowly roll the ball from the base of your heel all the way up to the ball of your foot. We want a slow, relaxed rhythm. Do not rush this. Now, move it side to side across the arch. Finally, make small circular motions, clockwise, then counterclockwise. While you do this, I want you to practice mindfulness. Close your eyes. Send all your focus to the bottom of your foot. What do you feel? Is it tender? Is it numb? If you find a tender spot, hold the ball there for 10 seconds and take a deep breath. Do this for about 1 to 2 minutes on the right foot, and then switch to the left foot. Yes, even if only one foot is tingling, we treat both sides to maintain symmetry in the nervous system. Doing this daily will break up fascial adhesions and vastly improve local circulation. Moving on to phase 2, mobility and blood flow. Now that we have awakened the sensory nerves, let's fire up the motor nerves, the ones that control the tiny intrinsic muscles of your feet. When neuropathy sets in, these muscles often waste away because they aren't getting proper signals. We need to rebuild them. For exercise 2, the towel scrunch, place a hand towel flat on the ground in front of you while seated. Place your bare foot over the towel. Keeping your heel planted on the ground, use only your toes to grab the towel and scrunch it toward you. Grab, pull, release. Grab, pull, release. It looks simple, but if you have neuropathy, this might feel incredibly difficult, almost like your toes won't listen to your brain. That is exactly why we must practice it. You are rebuilding the neural pathways. Do this until you have scrunched the whole towel, then flatten it out and repeat it with the other foot. Aim for 3 sets on each foot. Over time, as your muscles get stronger, you can place a small weight, like a soup can, at the far end of the towel to add resistance. Next is exercise 3, the 3-way ankle pump, also known as the calf muscle pump. Your calf muscle is sometimes called the second heart. When it contracts, it pumps venous blood back up to your lungs and heart, clearing out toxins and bringing fresh, oxygenated blood down to your toes. This exercise is vital. Here is the 3-step sequence. First, keep your heels on the ground and lift your toes as high as you can. Feel the stretch in your shins. Second, return the foot flat to the floor. Third, press down on your toes and lift your heels high into the air, contracting your calf muscles hard. Let's do this together. Toes up, flat, heels up. That's 1. Toes up, flat, heels up. That's 2. We want to do a continuous, smooth rhythm for 20 repetitions. Not only does this flush the leg with blood, but if you are diabetic, activating these large calf muscles helps pull glucose out of your bloodstream to be used as energy, which can temporarily assist in lowering blood sugar levels. Finally, phase 3, nerve gliding and stretching. Nerves are not elastic. They don't stretch like rubber bands. However, they do need to glide smoothly through the tissues, muscles, and fascia of your body. If a nerve is trapped or tethered, especially the massive sciatic nerve that runs down the back of your leg, it can cause terrible tingling in the foot. We are going to perform a nerve glide, also known as neural flossing. For exercise 4, the sciatic nerve floss, lie flat on your back. Bend your left knee so your foot is flat on the floor. Now, grab behind your right thigh with both hands and pull your knee toward your chest so your thigh is pointing straight up at the ceiling. Now, carefully and slowly, straighten your right knee, bringing your foot up toward the ceiling. Stop as soon as you feel a stretch in the back of your leg or a slight tingling. Do not push through pain. Here is the flossing part. As you straighten your leg, point your toes up toward the ceiling. Then, as you bend your knee back down, pull your toes back toward your shin. Straighten the knee and point the toes. Bend the knee and pull the toes back. By doing this opposite motion, we are pulling the nerve from one end and then the other, allowing it to slide smoothly through the tissue without overstretching it. Perform this gentle flossing motion 10 to 15 times on each leg. It should feel relieving, not painful. If you have lower back issues, this exercise can be an absolute game changer for foot tingling. For exercise 5, the full posterior chain stretch, remain on your back with both legs extended flat. For our final movement, we want to stretch the entire back line of the body. Keeping your legs straight on the floor, actively pull your toes back toward your shins as hard as you can. You will feel your calves tighten and your heels might even lift slightly off the floor. At the same time, tuck your chin slightly to elongate your cervical spine. Hold this full body tension for 5 seconds. 5, 4, 3, 2, 1. and relax. Let the feet flop outward. Repeat this active stretch 10 times. It helps release tension from the lower back all the way down the legs, opening up the pathways for your nervous system. Before we wrap up, we must talk about daily foot care. According to clinical guidelines, if you have any loss of sensation in your feet, proper hygiene is not optional. It is a medical necessity to prevent ulcers, infections, and amputations. Here is your daily checklist. First, the visual inspection. Every single night, look at the bottom of your feet. If you cannot bend over, use a small mirror on the floor. Look for cuts, blisters, redness, or swelling. Because your nerves are compromised, you might have stepped on a piece of glass or rubbed a blister without feeling any pain. Second, washing. Wash your feet daily with warm, not hot water. Always test the water temperature with your elbow or a thermometer first, because your feet may not accurately gauge how hot the water is, leading to severe burns. Third, moisturizing. Neuropathy often causes the skin of the feet to become very dry and cracked, which is an open invitation for bacteria. Apply a good quality lotion to the tops and bottoms of your feet, but never between the toes. Moisture between the toes can cause fungal infections. Fourth, footwear. Never walk barefoot, even inside your own house. Always wear well-fitting, supportive shoes or protective slippers. Make sure your shoes have a wide toe box so your toes are not squished together. While these exercises and lifestyle changes are powerful, neuropathy is a serious medical condition. You need to contact your doctor or a neurologist immediately if you experience any of the following red flag symptoms. Sudden onset. If the numbness or weakness appears suddenly rather than gradually over months. Rapid spreading. If the numbness is rapidly traveling up your leg toward your waist. Loss of motor control. If you develop foot drop, meaning you cannot lift the front of your foot, or you start tripping frequently. Bowel or bladder issues. If you lose control of your bathroom functions along with leg numbness, this is a medical emergency indicating a severe spinal issue. Or an open sore. If you find a sore on your foot that is not healing. Healing nerves requires patience. It requires consistency. You cannot do these exercises once and expect the tingling to vanish. But if you commit to this routine, if you control your blood sugar, correct your vitamin deficiencies, have an honest conversation with your doctor about the right non-opioid medications, and do these physical therapy exercises every single day, you will see improvement. You will notice that the burning isn't quite as sharp. You'll notice your balance improving. You'll notice that you can sleep a little deeper without the tingling waking you up. I want you to try this exact protocol for the next 14 days. Come back every day and follow along with the exercises. After 2 weeks, I want you to leave a comment telling me how your feet are feeling. Your success story might be exactly what someone else needs to read to find hope. If you found this masterclass helpful, please give this video a thumbs up so it can reach other people who are suffering in silence. Share it with a family member who has diabetes or complains of leg pain. Make sure to subscribe for more evidence-based medical and physical therapy guides. Until next time, keep moving, stay proactive about your health, and remember, your body has an incredible capacity to heal if you give it the right tools. I'm Dr. Franklin Reed, wishing you a happy and healthy week. Take care.